Good morning. I'm Muriel Bowser. I am the Mayor of Washington, D.C., and I'm joined this morning by members of my cabinet to provide a briefing on the district's response to COVID-19. I will start by providing a brief overview of where we are today, and then we'll share information about resources that can help our residents and businesses get by during these very uncertain times. While we began planning for this pandemic in February, it was just about a month ago, on March the 7th, that we announced our first confirmed COVID-19 case. We continue to work with the council and with our regional and federal partners to flatten the curve and implement programs to support our residents and businesses. The most recent mayor's order issued this week freezes hiring, salary increases, and travel at DC government. Exceptions will be made, but limited to the coronavirus response and public safety, human services, and staffing for our schools. We know that our residents and businesses are making very tough financial decisions right now, and the district will too. I want to thank members of the council and Chairman Mendelson for their collaboration and support throughout this public health emergency. And yesterday, during its first online meeting ever, the council passed the second COVID-19 emergency supplemental legislation. I am proud to have worked together on this important legislation, which provides additional supports for workers, renters, homeowners, local businesses, and students. And let me just say a couple of things about what you'll find in that legislation. And I know I'm going to get a more larger one so I can see it. I know that you can go to the council website and certainly coronavirus.dc.gov to learn more. Let me just mention 7 major components of the legislation. It provides emergency response and hospital assistance and assistance for the human services. It also harmonizes DC law and the CARES Act when it comes to employee protections. It attempts to reduce the population of incarcerated residents at the Bureau of Prisons, and it provides tenant and homeowner protections as well as consumer protections extended from DC Water and Pepco to the cable and telecommunications providers as well. It also focuses on small businesses by increasing CBE requirements to 50% on purchases outside of the emergency, and authorizes advance payments to CBEs where necessary. It also, in the education sphere, waives the 120 in-seat instructional hour requirements and waives the 100-hour community service requirement for all graduates. So again, I want to thank the DC Council for their swift action and turn you to their website or coronavirus.dc.gov for more information. And I would suggest you reading those requirements very carefully. Let me tell you a little bit about what's happening in the region. These regional numbers are as of yesterday, and we continue to monitor the situation, particularly as we are preparing for a medical surge. You will recall our discussions last week in letting you know what our modeling suggests and my conversations with the White House to focus on the nation's capital and our region as a potential next surge area. This morning we reported 229 new cases of COVID-19 in the district, bringing our total to 1,440 cases. Tragically, we also lost 5 lives. To date, 27 residents have passed away due to COVID-19. This week, we also began releasing COVID-19 data broken down by race. And while we have a lot of unknowns, we will continue to monitor this information carefully. We know that across the country, African Americans disproportionately suffer from some of the underlying conditions that make COVID-19 so dangerous. And of course, it's not just about looking at the data after the fact. It's doing everything we can to keep people safe, save lives, and mitigate the spread of the virus. So as we share this data, we continue asking all of our residents to stay home when not engaged in essential activities, because we know that stops the spread of the virus and saves lives. Testing remains a critical part of our response to COVID-19, and on Friday, we launched the COVID-19 testing site at UMC, the United Medical Center located in Ward 8. And between Friday and Monday, 160 people were tested at the site. And I'm urging residents in the priority testing groups to call for an appointment if they are experiencing COVID-19 symptoms. Residents can call the hotline, and that number is 855-363-0333, 855-363-0333. In another number where your calls and questions can be answered in Spanish is 844-796-2797, 844-796-2797. As we continue testing more people, we are also continuing to build out our local stockpile of supplies, and we keep an updated public list for your review. But also, if you are a supplier of medical equipment or things that can be used in an emergency, continue to reach out to us at vendor.relations@dc.gov, vendor.relations@dc.gov. So now I wanted to ask my team so we can set aside some time today to talk about what DC residents and businesses are experiencing at home, and share with you all that we know of the resources available. And we also know that resources become available in different programs all the time. So we will keep that information up to date at coronavirus.dc.gov. We, of course, know that these are very trying times for most people, and even more so for those who are suddenly not receiving their paycheck, or for those who have lost their business and had to lay off their employees. So we are using all the resources and tools at our disposal to support our residents and small businesses, and we want to share that information with you. I'm going to go over some of our public benefits programs. Then I'll turn to Unique Morris Hughes, who is the director of the district's Department of Employment Services, and she's going to talk about unemployment insurance claims. And then I will turn to the Department of Small and Local Businesses in Sabangale, also from the Deputy Mayor from Economic Development's team, to learn more about our small business programs. And Christy Whitfield is the director of our Department of Small and Local Businesses. So we'll hear from members of our team. Dr. Nesbitt will join me in answering questions at the end. So let's start with talking about public benefits programs. Residents impacted by COVID-19 may be eligible for food, cash, or medical assistance from the DC Department of Human Services through the Supplemental Nutrition Assistance Program, also known as SNAP, or from the Temporary Assistance for Needy Families Program, also known as TANF, and from Medicaid or the Alliance programs. To make the application process for these programs easier, DHS launched a new online application at dhs.dc.gov. New and returning users can apply for one or more of these programs by clicking Apply for Benefits and filling out the combined application. Additionally, residents who recently lost their employer health coverage or are currently uninsured can enroll right now through the DC Health Link at dchealthlink.com. And that website will guide you to the right place. Additionally, completed applications can be submitted electronically, mailed, faxed, or dropped off at a DHS, Department of Human Services, Service Center. To help enforce social distancing, DHS service centers are open only for picking up and dropping off applications and documents. Residents who need assistance or want an application mailed to them can call DHS call center at 202-727-5355. Customers who currently receive SNAP, TANF, Medicaid, or Alliance, or other public benefits provided by DHS do not need to take any additional action at this time to continue receiving benefits that would otherwise expire during the public health emergency. We have automatically extended those timelines. We are also working to get existing SNAP recipients more money to purchase groceries. The district was approved to provide SNAP households that are not currently receiving the maximum SNAP allotment with a temporary increase in March and April. These additional SNAP benefits will be automatically added to EBT cards, and no action is required from households who will receive that increase. The payment for each household will vary because it depends on your household size and the monthly allotment you currently receive. I also want to highlight that our emergency shelters are remaining open throughout this public health emergency, and I want to thank our providers who are running these facilities and supporting residents who stay at them, and of course our entire team at DHS. If you are a family without safe housing, please call the shelter hotline at 202-399-7903. You can also be connected by calling 311. Now I want to turn to our discussion about unemployment insurance, and I'll turn to Unique Morris Hughes to provide an update.
Thank you, Mayor Bowser, for your leadership during this unprecedented time. My name is Unique Morris Hughes. I am the Director of the Department of Employment Services, and I have the privilege of serving Director and representing the men and women who I consider to be economic first responders. During this unprecedented time, we are faced with economic challenges that is affecting the district's labor force. As reported by the Department of Labor, 6.6 million unemployment claims were filed nationwide. Last week, over 10 million in 2 weeks. As of April 6th, 53,148 new claims for unemployment compensation benefits have been filed in the District of Columbia since March 13th. From March 13th to April 6th, over 18,000 payments have been made, totaling over $6.5 million. At DOES, we're working expeditiously to ensure all claims are processed and everyone's concerns are addressed. We know the process can be frustrating and exhausting. However, we appreciate everyone's patience as we work through this unprecedented time. A few things to note. 1, unemployment insurance benefits have been expanded, eligibility has been expanded, extended benefits are being offered, and enhanced benefits are being offered. Currently, our online system has been updated, so any challenges with the waiting week has been updated, and the job search requirements have been waived. Claimants can visit the DOES.dc.gov website for more information on how to file for unemployment insurance benefits. Additionally, we have a plethora of frequently asked questions, scenarios, and helpful information for every individual that's in need of economic support and benefits during this time through our unemployment insurance compensation program. I want to remind everyone who is eligible for unemployment insurance compensation that applies for this benefit that all benefits will be paid. I'd also like to remind individuals that claimants should file on a desktop or laptop, and to avoid long waiting times by phone, we ask that people go to DOES.dc.gov to file online. We appreciate your patience as my team works diligently to ensure all issues are resolved. We also ask you to continue to visit our website as we provide updated information on expanded eligibility to cover those that are self-employed and 1099s. We want to remind everyone that we're all in this together and we will get through this together. At the conclusion of this presentation, I'm happy to answer any additional questions related to unemployment insurance. Thank you, Mayor Bowser.
Thank you so much, Unique, for that, and I know we'll have some time to talk more. So now I want to turn to our small business team and to talk about small business resources. Christy, are you going to begin?
Yes.
Okay,
Thank you, Mayor Bowser. Thank you, Mayor Bowser, for your strong leadership, and as we chart these uncharted territories. My comments today will be on two fronts. We will be first talking about the federal resources and then about some local resources. I also wanted to take a moment and thank DSLBD's dedicated team for the work that they're doing daily to put the district businesses first. On behalf of the Bowser administration, DSLBD is serving as the liaison with the Small Business Administration, and SBA has released some important existing resources for local businesses, and then in addition, we will be looking forward to some resources through the CARES Act that we expect to become available by April 15th. The DSLBD team has been working hard with our federal and local partners to inform and assist district residents as they apply for some emergency resources. Hopefully everyone has heard about the economic injury disaster loans and the emergency loan assistance. These are currently available at disasterrelief.sba.gov. These loans provide up to $2 million at 3.75 interest rates for 30 years fixed. There are no payments due for the first year, and these loans are available now and people can apply online. There's online help available through the SBA, and also DSLBD is available to help people apply for these loans. If you need help, you can call DSLBD 202-727-3900, and we can also help people walk through those loans. The Paycheck Protection Program was recently became available this week, and it is a great program that helps people keep employees on their payroll during these difficult times. If you have an SBA lender, you reach out to your lenders directly, and they can help you get a loan to keep your business going. There are some loans that are available soon through the SBA, Express Bridge loans. These loans are up to $25,000, and they will be available by the 15th. We'll have full information about how these loans will be available. And then there's some SBA debt relief for people that have current loans, and this will be also we'll have more information about how those loans will be. Those were released through the CARES Act, and by the 15th, we'll have full information about how those loans will be able to be operated. The deputy mayor will be having a meeting that I think we'll have more information on this Friday. We'll be announcing at 4 p.m. on Friday. We'll be getting out to the business community, and our partners from the SBA will be giving full information directly about how those loans and how those programs will be made available. Now locally, the DSLBD team remains fully engaged in working with our small business community at every level. Certification and compliance continue to happen, on a daily basis. Our business opportunities and our PTAC teams are working hand in hand with the business community to apply for these loans that we recently mentioned. Excuse me. We are working in partnership with DEMPED and other agencies to host or co-host stakeholder calls to make sure that our businesses stay up to date and informed about current and ongoing resources and developments. And like our business partners, DSLBD remains deeply focused on resources. We were very, very pleased to work with partners to make sure that we were able to get resources into the hands of our local businesses across corridors. We know that our main streets and our businesses need cash and they need money now. Many of the activities that Main Streets were planning, street fairs, et cetera, are not relevant in today's environment. DSLBD, at the urging of the Bowser administration, repurposed the budgets of many of the main streets, and we put those budgets towards immediate grant funding for those main streets, and we're able to open up over $600,000 in grant funds, and the main streets have those funds available right now. District Bridges, which runs 5 main streets across the city, was able to allocate $50,000 in grant funding that's available right now. The Georgetown Main Street has a $30,000 fund for COVID relief. If you're in the Georgetown Main Street, please call that Georgetown Main Street. Those funds are available, and those funds are there for you to make it through this crisis. You know, our main streets, our clean teams, and our bids are the boots of the ground to help our commercial corridors make it through this crisis. We know that our businesses are there working for us each and every day, and we want to make sure that those resources are there as expeditiously as possible. Very recently, on the 15th, DSLBD closed a round of robust retail. 4 days after the first executive order came from Mayor Bowser. DSLBD sees this opportunity to respond to the need of our most vulnerable businesses, and the mayor used this emergency legislation to infuse this round of funding with an additional $330,000 into this program. We were able to grant $7,500 to over 100 businesses. This was the largest round of funds that DSLBD had ever done, and we were able to release these funds in record time thanks to the Bowser administration and cooperation across every branch of this government. We want to thank Mayor Bowser for her dedication to our businesses in this way and the ability to respond in such a fast and expeditious way. We know at DSLBD that these are difficult times and that we are in uncharted territory, but I want to thank the DC business community for the things that they continue to do, because we know that one thing that is unchanged through all of this uncertainty is the strength of the entrepreneurial spirit that's driving the business community. We know that every day our small businesses continue to serve our communities, whether it was Jose Andres feeding the homeless in the downtown bid, or Gelberg Signs, a local CBE, giving free signs to essential businesses to let people know that they are indeed still open, or the less public heroism of small business owners foregoing things so that they can keep cherished staff people on their payroll for just a little bit longer. We are shaping our recovery right now, and small businesses are an essential part of that picture. And we want to thank Mayor Bowser for her strong leadership and continuous support of our business community. Thank you, Mayor Bowser.
Thank you. Thank you. Sabangale.
Thank you, Mayor Bowser, and thank you so much for your leadership and vision. My name is Sabangale Cook. I am the Director of Business Development and Strategy in the Deputy Mayor's Office for Planning and Economic Development. And as we proactively plan and strategize to restart business activities, support our workforce, and also ensure that our residents here continue to call DC home, the mayor created the District Economic Recovery Team, which is called DIRT. And so it's a threefold process. The goals are, number one, to prepare the district to deploy federal funds that can support employers, workers, and also address our housing needs. Number two, to coordinate agency efforts to accelerate, to modify, to even create local programs that most effectively support our employers, our housing needs, and our workforce. The third is to make and implement plans to restart the district's social and economic spheres, but more specifically honing in on our most vulnerable and most affected communities here in the district. I'll lead into going into some of our other resources. As you may or may not know, the district has a DC Small Recovery Microgrant that the mayor and the council put together. It's a $25 million fund that is run out of DEMPED's office. Eligible businesses, small businesses, nonprofits, self-employed, and contractors were all eligible. The amount of the award is up to $25,000. The award, the application closed last week. We received more than 7,000 applications. An estimated 4,900 small businesses applied, roughly about 500 nonprofits applied, and an estimated 1,600 independent contractors and self-employed individuals applied. We expect to begin notifying notifications of awards throughout the month of April. I also wanted to kind of share a preview out of the Department of Housing and Community Development. They've developed a new $1.5 million program with a small amount from our CDBG, our Community Development Block Grant Fund, to also support small businesses in this time specific to Wards 7 and 8. Calls for those applications will be in early May, so continue to take a look at the coronavirus.dc.gov website for more information. Something else that's coming out of DHCD's shop is tenant-based rental assistance for individuals. Using $1.5 million in federal home funds, DCHD will provide rental assistance to low-income tenant households living in properties facing significant financial impact as a result of COVID-19. Again, stay tuned, continue to look at the coronavirus.dc.gov website for more information. Other small business local resources here is also through the Greater Washington Community Foundation. They've created the COVID-19 Emergency Response Fund. Their priorities are education and youth, workforce and small business, medical care and access, homeless and housing, and also general operating support specific to our nonprofit ecosystem here in the region. And so those that are eligible are local nonprofits. The award amount ranges between $10,000 and $100,000. The timing of those awards are reviewed on a weekly basis. There's more information, of course, on our website, coronavirus.dc.gov, for that information. Also, the other funding recovery fund is Verizon's Small Business Recovery Fund. This is done in partnership with LISC, otherwise known as Local Initiative Support Corporation. They have put together a $2.5 million investment fund that is available to small businesses. They just closed their first round. They are resuming a second round in mid-April. It is available to small businesses here, particularly to entrepreneurs of color and those that are historically in unserved communities. The award amount is up to $10,000. For any other questions that you might have related to small business resources, we encourage you to go to the coronavirus.dc.gov website /recovery-business, and please feel free to fill out our inquiry form as we will continue to respond to any questions that you might have. Thank you.
Thank you. So with that, we'll take questions. Why don't we just start on this side and work our way over? Have a question here? Any questions? Okay, questions?
Question from Employment Services. I've been texting with a restaurant worker who's very frustrated. He filed on March 17th and has still not gotten any money at all. And let me just read you what he said. Tell me if it's true or false. He says they have to manually approve week one's payments, which will allow the following weeks to go through. This is what I've been told by someone that finally got through and spoke to an agent. Week one's typically the waiting period, but they waive that. So if you don't call and speak to someone, it will stay stagnant and you won't be paid because of the sheer volume. True or false?
False. So the waiting week issue was resolved in our online benefit system. Later today, I'll receive and be briefed by my team on additional payment numbers. But what we know is that almost 20,000 DC workers have been paid Many of those filed early between March 13th and April 3rd. And so my recommendation is for this particular individual to reach out to us on our UI escalations email address, which is covid19.ui@dc.gov, so I can have a person from my rapid response team respond and assist this individual.
All right, if I could follow up on your numbers, 18,478 paid. Can you tell me of the 53,148 claims, let me rephrase that. Of the 53,148 claims, have they all been approved?
So not all have been approved, but of the 53,000, over 18,000 individuals, unique individuals, have received payment. So what we do is we have to adjudicate each claim. Each individual employee has a unique circumstance. Some are very straightforward, we're able to approve. Others require follow-up. And so everyone will be touched and followed up, and all eligible benefit payments will be paid.
And if I could also follow up on those 18,478, is that going in sequence of when you filed, or if you filed like yesterday, could you have gotten a payment?
So if you filed yesterday, you have not gotten a payment yet, for sure. There is some sequencing to it, but there are some individuals who have less complicated work circumstances that may have applied after Friday, March 13th that may have been paid. It really is unique to each individual, and that's why we ask folks to reach out to us directly so we could help employees through their unique circumstances. Thank you.
Questions?
Mayor, I listened to a hearing yesterday in federal court, and Judge Pollard was telling, I think today, is selecting someone to go into the DC jail to determine basically the conditions there. Information was that basically the number of people testing positive has quadrupled in the jail in the last week. And my question is, they talked about things like basic soap is not available in some cases to the inmates. Since we've been talking about this, Mayor, has any of this changed? I mean,
That is not our information, Sam, but we will welcome what the court has ordered and look forward to the inspector coming. And certainly, we remain concerned about the spread of the virus. I think you know that the census in the jail is significantly reduced since we started having these briefings, which we think will give more opportunities for distancing within the jail. So we look forward to welcoming any inspector that the courts appoint.
so Mayor, have you talked to some of the folks over there? For example, we heard in the hearing yesterday that they were letting at some point 40 people out at once, and that's obviously a violation of your situation where you say maximum, I don't know what it is today, 10. Well, I guess it's stay home. Obviously, that's the situation.
I'm not sure I follow your question.
What I'm saying is basically we understood that, listening to the testimony, in some cases they were letting 40 people out at once, you know, when they, I guess, get into.
You mean for recreation?
Yes.
Okay.
Right, and so that strikes me as certainly a violation if you're trying to cut down on the spread.
I have talked to the director about that, and it was our understanding that they were minimizing the number of people who had recreation at the same time, though they want people to have recreation time outside.
And finally, they use the phrase deliberate indifference. How do you react to that? That was the ACLU and DC Public Defender saying the attitude of the city was deliberate indifference.
I can't comment on something I didn't hear and don't know the context of, but I can tell you that we are and have been very concerned about making sure that we can provide the appropriate distance, quarantine space, testing, and making sure that our staff and inmates at the jail can be kept safe. Now, certainly none of us wants to see the virus in the jail, and that's why DOC was very aggressive about limiting visitation and making sure that our employees and inmates at the jail were not introduced to the virus from outside. And despite everybody's best efforts, we see in a lot of congregate settings, not just here, but across the nation and across the world, that the virus can enter. And then at that point, what every manager, in this case the warden and DOC director, has to do is make sure they isolate the infected, quarantine any people who may have been impacted by that person, and continue with disinfecting and cleaning routines that will keep the facility safe. And that's what we
all at least have a bar of soap. That was a big issue.
as I mentioned, I have not been alerted to anybody not having soap. Yes, any questions here? Yes.
We'll start off with Dr. Morris Hughes. We've been getting a lot of questions from workers about when they can see changes to the DC unemployment system that reflects the changes under the federal relief legislation. What's the latest on that?
So we anticipate that in the next few weeks, we will have system updates reflected to offer the extended benefit, which is an additional $600 that will go on top of our maximum weekly benefit. Additionally, we will have information on our website today about PUA, which is the pandemic unemployment assistance benefit that's offered through the CARES Act. It will be a mechanism for individuals to email us and send us their contact information. So when the system updates, we will reach out to them immediately and begin processing applications.
And what's the latest on efforts to increase capacity for claims taking, like the contract that you mentioned that was being negotiated?
Yep, thank you for asking this. I think we've made tremendous strides here, thanks to Mayor Bowser. We have secured 72 additional contract resources on top of the resources that we have at DOES. Additionally, we've been leading a intergovernment effort to have other district employees support us. We think we'll have an additional 100 employees there. So we think we'll be about 200 strong to help us man our phone lines and support this effort. And just to give you some context here, I was on the phone with the state leaders of workforce agencies across the U.S., but specifically focused on the East Coast. Florida received 1.5 million calls last Thursday. They have 90 call takers. We're probably at about 10,000 and we'll be 200 strong. So the District of Columbia is prepared to answer the challenges that COVID-19 has presented.
Dr. Nesbitt, one of the things we saw in today's data was that 50% of the test results that came back were positive. Can you explain that?
Can you clarify your question?
Yeah, so the increase in testing data and test results received as of today's data release was somewhere in the mid-400s, and the number of positive cases was 224. That was 50% of the results that came back were positive, and that's significantly higher than the 10 to 20% range we've been seeing. What's going on there?
So our overall positivity rate is about 17%, meaning all of the people who have been tested since we've been testing people is about 17%. I would caution against making any inference to data released on a daily basis. So as you have posed the question for the number of tests that were reported out in terms of negatives and positives on any particular day, it's important to remember that an individual's symptom onset and the day that their sample is collected may be variable by individual. So we observe the positivity rate. It would be correct to observe that the positivity rate continues to increase in the district, and that can be a function of a number of things. We have encouraged people to prioritize testing for individuals who are most likely to have a severe form of illness or more complications if they were to become infected with COVID-19, or to have COVID-19 be the reason for the presentation of their symptoms of fever, cough, shortness of breath, or in children, as I mentioned before, they may be more likely to present with loss of appetite, or vomiting or diarrhea, or in the elderly, presenting with symptoms of fatigue or body aches. And so what we may be observing is that we're seeing our healthcare providers, the doctors who decide who gets tested, them being more focused on those priority groups. People who are hospitalized, our healthcare workers, first responders, individuals over the age of 65, people who have underlying health conditions, and focusing on individuals who have symptoms being tested. In some of the discussions that I'm in nationally and regionally, some of the state public health labs, their test positivity rate is in the 80s, so really high. Only having people who are demonstrating those signs and symptoms coming into contact with individuals who have laboratory confirmed COVID-19 being the individuals who are actually being tested.
We were previously told that the UMC drive-through testing site would be able to handle 300 patients a day. We had 161 the first 2 days. What's going on there?
So we have 200 people scheduled for today. So there's anytime you start a new initiative or launch a new service to the community, there's a period of time where people have to become more aware of the availability of that service, and so that is likely what happened in those first couple of days.
And those samples are being tested by the public health lab?
That is correct.
With a 24-hour turnaround?
The goal is to have the test results available within 3 to 5 days. And part of that is because, as you know, most laboratories have what's called accessioning, and so the samples have to come in, be logged, and then the results have to be made available, typically through an electronic process. So people should be notified of their results being available within 3 days. The actual processing of the sample does not take 3 days. It happens in a matter of hours.
Mayor Bowser, can you update us on enforcement of the stay-at-home order? We started seeing Governor Hogan in Maryland releasing a number of people arrested, visited, and all that.
I'm not aware of anybody being arrested.
Anything more on the enforcement efforts underway?
Where our focus is on our food markets, and we will be hopefully tomorrow updating on the status of food markets across the district. And we have maintained that we're concerned about all of including the fish market, the fresh fruit markets, making sure they're doing essential activity, and that social distancing is being observed. So we spent, and our food policy team has spent some time yesterday working with those organizations, and tomorrow we expect to talk about food access.
The last one, this is from Peter Herman. Can you comment about some of the crime trends that we've been seeing? We're seeing overall violent crime fall since the first COVID-19 case, but we have seen assaults going up. Do you know what's going on there?
I would, let's have the deputy mayor talk to you about crime data in general. I think I didn't get another update on Monday. I usually have my updates on Monday. But I think that the trend we see is that property crime is way down, but we continue to be very focused on violent crime. Yes, Mark.
Pushing back to unemployment, you've given a lot of numbers. How many claims have been denied?
I don't have that data in front of me. What makes that data point complex is that we give people an opportunity to appeal. So let me follow up with my team and see what we can provide.
And then can I ask, people who receive 1099s, what is this? Are they able to apply for unemployment? Some people have applied and weren't able to get through.
Sure, I'd be happy to answer. I covered this, I think, in the response to Fennett. Currently, our system is not updated. We anticipate it will be a few weeks before the system changes take into effect. On our website, we will have a mechanism for 1099s and self-employed individuals to submit information, so we can contact them and begin processing their application immediately once system updates have occurred.
Unique, right, if I can jump in for a second, Mark, why don't you talk about what changed with CARES and how that necessitates a change to the system.
Sure. Thank you, Mayor. So with the CARES Act, unemployment eligibility expanded. So prior to now, or in normal circumstances, if you are self-employed, or a gig worker or contractor, a 1099 contractor, you are not able to receive unemployment insurance. What the CARES Act did, and what the council legislation also did, was to expand eligibility. Because this is not part of our normal unemployment insurance benefits offering, it requires a system modification and change. So that's why we have to modify the system, and that's what we're doing right now, is putting the infrastructure in place to accept a whole new population of individuals who are now eligible to receive the benefits.
But when we started discussion about relief for individuals, we didn't know where those 1099 employees would fall. And the federal requirements have changed, which will allow them to claim unemployment. And so I think what Unique has set up is we want those workers to contact us via the email that she has provided. And then when the system changes are done, we will alert them that they can then file their claim.
And so if somebody had previously applied and was denied because of that, they need to reapply?
They will need to reapply.
Okay, so let me ask you this. If I'm a 1099 employer, say I'm a musician and I'm a gig employee, but I have gigs in DC, Maryland, and Virginia, right? I don't have a constant gig everywhere. Where do I apply? Where I live, or do I find, how does that work?
So that's a little bit more complicated, and I want to be careful not to adjudicate a claim here. But for individuals that have complex work history like that, we want you to contact us, and we will walk you through what we need to prove your income and wages here in the District of Columbia.
And then if I one more on unemployment.
Sure.
I've heard from a couple of DCPS substitute teachers who say because schools are closed, they're not getting any hours. They haven't technically been laid off because they're substitutes. I don't know how they're classified, but they say when they apply, they've been denied because they weren't laid off. But I don't know how many substitute teachers DCPS has, but they all seem to be in the same boat.
Sure. So again, I think this is a complex situation. If you're a substitute, there's a reasonable assurance that you're going back to work. You may not technically be considered unemployed, but I will work with my team and I'll work with the chancellor to make sure I fully understand the situation. If an individual is eligible, we will make sure that they are paid.
I have a couple more questions on unemployment.
1 second, please. Yes?
Mayor Bowser, as you probably heard, Los Angeles has instituted a face mask requirement, and they're looking at that in a different context in Montgomery County. Have you considered a possible face mask requirement here in the city?
We have, and Dr. Nesbitt, can you speak to the guidance that you've issued on face masks?
Sure, I'd be happy to. What has happened in some jurisdictions is that they have been using the CDC guidelines that came out last week, where their issuance of a requirement for face masks in public is not necessarily for a continuous use of a face mask in public, but where the social distancing adherence cannot be met. So what that means is that if you are out in public and you cannot safely maintain or continuously maintain 6 feet of distance between you and another individual, that it would be recommended that you wear a face mask, which is consistent with the CDC requirement. And it's not necessarily a face mask, but rather a face covering. So we're asking that people can actually use cloth face coverings. They could even be homemade, so that we continue to preserve the surgical mask and the respirators for the healthcare community who would be in need of these surgical masks and respirators until we can improve the distribution of these things in the supply chain. So what does it mean to not be able to safely maintain the social distance requirements that we have asked people to do, and what are some examples of those types of environments? So when you're out in environments that we now know the science says that it's not just coughing and sneezing, but it can even be talking, where some of these respiratory droplets that can carry the virus can be shared between two people, and you can't safely maintain the 6 feet of distance. So when you're out conducting those essential services that you need to do, we are asking you to stay at home, but you still may need to do essential activities, such as going to the grocery store or the pharmacy or the doctor's office. These recommendations for face coverings are being made to that end. So we have issued guidance in the District of Columbia for the use of face masks or face coverings for the general public that is also consistent with that. And it was put out over the weekend. But again, it's making sure that you do that while also adhering to the social distancing requirements that we have asked people to do, including stay home. Wearing a face covering is not a replacement for the impact of staying at home and adhering to the social distancing requirements. It is critically important that people understand that. And face coverings should only be worn by people who could do it safely and could put it on themselves. So we're not asking for face coverings to be put on infants, people younger than 2 years old, who cannot actually put these face coverings on and keep them on safely. The face covering should not be touched frequently while wearing them or touched at all in the front. If you are using a disposable face covering, it should be discarded after use immediately in a trash receptacle. It should not be left around for other people to incidentally touch it. And it should always be removed from the back. So if you have on one with ear hooks, you should remove it by the ear hooks. And if you have on one that is washable and cloth, it should be washed daily. Not doing so can actually increase transmission of the virus. Not using them appropriately can increase transmission of the virus. So it's extremely important that you look at the recommendation from any jurisdiction that is recommending the use of face coverings, that you use them as recommended by that jurisdiction and follow the CDC guidelines for use as appropriate.
Okay, thank you, Doctor. Any questions here? Yep.
Yes, I'm going to follow up on unemployment, please. If people are able to get on a computer, and it's my understanding they get a profile, is that correct? They file?
Yes, they do.
Is there been any updated information as to whether or not you're able to put on there when they will get money, when they will be paid?
So in each individual's profile, there are updates to their account. So for individuals, and there are some individuals that have already received 2 payments, there is an update that says your claim has been approved for this week or your claim was denied. That information is active in real time and is updated by our team.
So if someone was approved and they filed 2 weeks ago and yet haven't gotten any money, if they go onto their profile, is there a reason why they're not seeing when they would get paid?
So a couple of things. One, it's very difficult to answer generally questions that I think may be unique to certain individual circumstances. The best thing for this individual to do is to contact our escalation email address, which I have a UI rapid response team that is handling unique circumstances. After this, I'll make sure that you have that and you can share it with this particular individual. But everybody has a profile. Everybody receives updates of when their claims have been approved or denied and why.
Also, is there any data showing that you're more likely to get service if you call rather than file online?
No, because we offer everybody the same level and quality of service, whether it's online or over the phone. So no, we don't have any specific data to that, but what I can guarantee the public is however you reach us, email, phone, online, you will get the same type of service. Your claims will be processed at the same exact rate.
All right, and then perhaps what might help people that are out there is what is the reality here? I know you've been overwhelmed. This is highly unusual, what you're up against. What is the real reality here as far as being able to process the huge number of calls and requests?
So the reality is that the District of Columbia is not unique, and like every other state in this country, where we have seen a significant pressure on our UI infrastructure. That is the reality. The reality is also that the District of Columbia is #1 in the region with first payment promptness. What that means is that the Department of Labor has said, DC, you are accurately and effectively paying individuals at a higher rate than any other jurisdiction in the region. It's also the reality that claims taken over the phone has been a lengthy process for us. And because of that, that's why we stepped up our efforts to make sure we have additional both contract and government resources answering the phones.
Dr. Nesbitt, yesterday the state of Maryland put up a rumor, how would you call it, a website that knocks down rumors. And one of their knockdown rumors said this, and I'm curious what your opinion is the question was, I can get coronavirus by ordering carry-out delivery. And the response here on the state of Maryland's website says, here are the facts. At this time, there's no evidence of food or food packaging being associated with transmission of COVID-19. What's your opinion on that?
We've been trying to get people to understand the safety of the food supply and the safety of being able to consume delivered foods and products. The FDA also and the USDA also have been putting out information about the safety of the food supply and publish FAQs frequently. So I'd also encourage people to check those websites. And we reproduce information and send things to our food manufacturers, our grocers, and our food deliverers often as well. I have also noticed that people are doing things, ordering groceries and then not touching them for 72 hours and a host of other things. There is no recommendation for people to need to do that.
One of the follow-up. If you're wearing an N95 mask, are you protected against getting the virus?
I would ask that the N95 mask be reserved for people who are likely to be performing what we call an aerosolized procedure, which tend to be our healthcare workers and possibly our first responders who may be performing or providing a nebulized treatment to someone who's in transport on an ambulance. So if you're not doing something like that, I would ask that you not purchase N95 masks or have access to them and save them from our healthcare providers. What we know now, and the evidence tells us that N95 respirators protect against the virus. And that's why we are recommending them for healthcare providers' use and those who are providing what we call aerosolized procedures that could cause the virus to be aerosolized and therefore transferred between individuals. So yes, they are considered best practice for use in a healthcare setting.
Yes, Bennett.
Dr. Nesbitt, what's the latest on hospitalization and COVID-19 patients? And can the district start providing daily hospitalization figures as Maryland and Virginia have done?
So the answer to that is twofold. This is one of the complexities of being a jurisdiction where you have patients coming in from two places. So what you are observing is you have states that can easily provide you very clean numbers of the number of people who are in the hospital, and that be indicative of the number of people who are their cases in their state who are hospitalized. That would not be fact for us here in the district. So I could easily report to you the number of people who are hospitalized every day in the district. You cannot make that equal to the number of cases that we have in the district who are hospitalized. They're not the same number. So when we are hesitant to provide daily statistics, that hesitation has a rationale behind it. So every day I'm tracking the number of people who are hospitalized in district hospitals, the number of people who are hospitalized in ICUs, and the number of people who are on ventilators. And I'm doing that so we can observe trends and we can actually have that match when we are potentially seeing a surge in demand for those services and approaching the medical surge needs that we identified and spoke very openly about on Friday. There's a second piece of it where when we are doing our surveillance work and needing to conduct background information for every positive case that we have reported, the 1,440 cases now that we have in the district, we have to go back and interview many of those individuals and then confirm how many of them were actually hospitalized. That's a different amount of legwork. It's part of why we still have missing race and ethnicity data for everyone. Race and ethnicity data is not available on a lab form that comes to the health department to confirm a positive case. We have to go back and find that information in a number of ways, which can include interviewing someone and asking them overtly their race and or ethnicity. So other states that tend to have 100% of the people in their hospitals be from their jurisdiction can more cleanly provide you that data. In the district, on a day-to-day basis, 45% of the people who are in our hospitals are not DC residents. So that data here is not as clean.
So what are the latest hospitalization?
So we have, currently there are 226 people hospitalized in the district. That includes residents who are, people who are not DC residents.
Mayor Bowser, can you update us on what your office is doing to help undocumented immigrants and what your timeline is here for offering any sort of proposals or assistance measures?
Well, we continue to look around the country to see the types of assistance that are being offered, especially private philanthropic help, and that's what we will continue to do. Yes?
I guess I'd like to ask Dr. Morris you this question. If you have a picture of the situation, a couple of weeks ago, I guess last week, the city hired someone to go in and deep clean the second shelter. One of the contractors there said they advertised for, I guess, a couple dozen jobs, 200 people showed up. I think it's like there's a group of people out there who, you know, maybe they can't file, they don't have any kind of particular safety net. What's the picture for them? Say, you mentioned undocumented people, I think there are other folks that go to labor ready every day. Do you have a sense of that?
So we're always in recovery mode, and there are a lot of opportunities for individuals to be employed and work, not just with the example that you've provided, but there now also seems to be a lot of at-home work opportunities available. At dcnetworks.org, if an employer has an opportunity in person, safely in person, or online, they can register and post the job opening that they have there. And every single person who files for unemployment insurance and any of our workforce programs at DOES can search the job postings. And it's a great way to make a connection with those who are actively looking for employment right now for whatever reason, and employers that are seeking talent.
But do you have a sense of how many people are out there who don't, let's say marginalized people who don't have?
So we don't have that data. My guess is that as the next several weeks go on, all of the jurisdictions are going to be looking at the labor workforce number and trying to observe trends and understand how many individuals are truly searching for employment right now. I don't have that data in front of me.
Okay, last two. Yes.
Just a quick unemployment follow-up. So just generally, if people have applied and been approved and are still waiting, when will those checks?
So generally it takes us 21 days, but we've been able to process payments roughly around 14 days. And so I've already reported about 18,000 or over 18,000 individuals have received payment. So I ask folks to be patient, to check their email, to check their portal. It may be a unique circumstance where they have to provide additional information or follow-up is required. Everybody who is eligible for unemployment insurance benefits will be paid.
Mayor Bowser, could you talk again just a little bit to small businesses and just kind of sum up if you can, and speak to these small businesses who are freaking out, wondering if they're going to be able to ever reopen again, not just if they're going to survive, financially this crisis, and what help is available to them?
Well, thank you. So we organized this time this morning to spend talking about all the programs that we've made available locally including the new one, the Microgrant program, where we've identified $25 million worth of assistance. Those more than 7,000 applications are being processed, and we will be making grants throughout the month of April. We also talked about just finding different programs that already exist, like our retail program and funds from CDBG, and various things that the district offers to try to push more dollars out to our small businesses. Clearly, we know if our small businesses can make it and come back, then our workers can come back. All of our workers can come back, and that's hugely important. We started this conversation, however, Mark, when the SBA application became available, when I think we were the first jurisdiction to be approved for the major disaster declaration in SBA terms, and people started applying there. We know that it's morphed into this Paycheck Protection Act, Paycheck Protection Plan, and it was 3 Ps. And I know there's some frustration with that federal program as well, because it's new, represents billions of dollars, and it's going through banks. So I would continue to urge our businesses to find out everything that they can and apply for those resources, because those are forgivable loans that will allow you to keep people on your payroll, pay your mortgage, pay your rent, and get back to business faster when we're able to open up again. So I would stay very, very focused on learning about every program and service that you can. Take advantage of them as well. And more than that, I would continue to urge not only our businesses, but our residents to reach out to your creditors and your landlords. There has been protections put in place in the council's bill, but that should not stop you from reaching out to your mortgage companies to make sure that you are doing everything that you're supposed to do to qualify for a deferral. If you're renting commercial or residential, reach out to the property owner, because there are protections from evictions, but that doesn't stop rent due. There are protections from rent increases, but that doesn't stop rent due. So you will want to reach out to the property owners to make sure you have an arrangement. So those are some things to keep in mind, but I would continue to say, focus on all of the federal resources that are available. You've heard me say this before. The breadth of the demand, of the need that this pandemic has created, not just in our city, but around the country, that we won't be able to handle locally. There won't be a local program to meet every person's needs. So we need everybody to focus on research, find out, call, get on anything that you can to find out what federal resources are available to you and make sure you're applying for them. Yes?
Mayor Bowser, I'm following up on Mark's question in a somewhat different context. Many district residents aren't able to get their nails done, get their hair done, or get their hair cut, and that's caused some frustration with people. Would you consider perhaps in the near future maybe a partial relaxing of the non-essential business requirement?
We don't expect to, no. But I would say that we're all thinking about, not just on my team, but across the nation, what it's going to take to slowly turn the spigot back on in opening up. And so we're seeing some examples from around the world, and I think we'll begin to see examples in the U.S. So we're following those examples very closely. And you should know, in the lead up to the closure for essential businesses, one of all essential businesses, one group of people were I call it the beauty business. And it's a very, very important business in the district. It employs a lot of people who earn a good living here. And those folks are suffering. A lot of them are the 1099 workers that have been asked about. and they will become eligible for unemployment as well. But they also had a lot of concerns about their own safety in staying open, and the expectation that they stay open. So there is a need for people to stay home. I know we're all concerned about being able to get back to those services. Certainly I am, but we have to do it in a way that's safe for the whole city. Okay, thank you, everybody.